Hi, I'm Dr. Julie Steinhauer. Today I want to talk to you about a topic that's increasingly probably the number one thing that people are reaching out to us about is they're having problems with dizziness. It's not vertigo. They've checked their inner ear. They've checked this. They've checked that. What the heck is it? But it's affecting their driving. All right, let's tell you first. So how you can connect with me, call me if you're local at 618-288-1489. If you're not local to us, that's okay, because we do have patients that we work with from all over the world, coordinating information with their doctors and helping them to have better vision. So you can go to our website at visionforlifeworks.com and you can either schedule a consultation, which if you're ready to take that next step, that's the appropriate step to take. Or if you just want to do some research, you can certainly read on our website and fill out a questionnaire. Now, let's talk about this topic, which I think is really important, and why we've got so many people who are contacting us. Dizziness, is it the inner ear? Do they have the Epley procedure? Did that help? Did they go through OT? Did that help? Did they look at and do MRIs and brain scans? Did that, unturn anything? This is a really complex thing that we're seeing a lot more of with our patients. And while I could venture some guesses as to why I think this is happening, I do have some theories. Perhaps for another video, but not for this one. But what do we do to actually correct this? What the heck is this? Why are people experiencing this on, I feel like, a crazy volume and level these days? Because clearly it's becoming something that I deal with almost on a daily basis in my clinic. And so there's usually a component of problem with aligning the two eyes together as a team. And most often than not, it's a vertical heterophoria or a vertical misplacement of the eye. It could also be a vertical tropia. And so there can be several reasons why it occurred. Again, we're not going to unpack that all in video today, but what do you do if this vertical misplacement of the eye is causing you to have bouts of dizziness, bouts of disorientation, and it's even affecting you whenever you do something like drive or walk up and down steps, or if you go to an area that's like a busy area. Maybe you go to a ball game, maybe you go to the mall, maybe you're going to the grocery store, and just the busyness of all of the people around and bustling of stuff happening. Or maybe with driving, it's the busyness of the road passing you quickly on both sides as you're trying to kind of keep up with stuff visually. So what's happening, this vertical misplacement of the eyes, kind of like, one eye's higher than the other or kind of moves a little bit higher. It can happen with just one eye. It can alternate back and forth. It can be fast, it can be slow. It can be a form of vertical misplacement that's actually more like nystagmus, where nystagmus is a movement of the eye and the eye can't stay still. If this happens, the vertical movement is like this, back and forth, and you can't control it. All of these types of things could potentially be going on. Particularly, again, if you have ruled out all of this other stuff. You had the MRI, it was normal. You had the, the ENT kind of diagnosis stuff, all of that kind of checked out normal. Not really sure that it's vertigo because you had the Epley procedure, and that really make it better. And maybe you even did, other things. There are other forms of treatment that you have undergone trying to correct this dizziness or disorientation problem. Let's talk to you about how we actually attack it in our office. We do have a program specifically designed for this because, again, in the last 2 years, we've seen this in increasing volume, and particularly in just the last 8 to 10 months, it is really becoming something of a, I hate to use a word because I don't want to have a association with anything else, but almost like a global pandemic of sorts, that people are experiencing this problem so significantly. So let's discuss how we kind of attack it and what we do to fix and correct it. So by watching lots of my videos, if you have or if you haven't, go look at them. I have a lot, but we use something called Syntonics. This is used in phase 1 of our treatment protocol. And what it does is it electrically kind of helps to reset the rhythm of the brain and reset things like alignment of the eyes based on a poor lack of muscle control from the brain to the eyes, telling them what to do this way or this way. And so we use Syntonics in order to kind of get that vertical misplacement of the eyes to start lessening by signaling the muscles of the eyes to know what to do a little bit better. Now, it's not just Syntonics that fixes and corrects this thing and is just, you know, done in like 2 weeks. It is a process. It does take time. If you have developed this condition called vertical heterophoria, vertical tropia, or maybe even a type of nystagmus that is associated with the vertical movement of the eyes, all of those things have there's a lot going on. And so those things need to be corrected and treated electrically within the brain. But then we have to do some kind of hands-on motor types of activities, teaching you how to still the eye, focus, being able to kind of like stop the movement and control it, and then learning how to be binocular and using the two eyes together better as a team. So 2 phases of treatment attack this problem. We have really tremendous success in helping our patients. It does take a while. It is not overnight. It is approximately a 15 to 16 month long program. But I do say for all of our patients who start with us, I promise it's going to get better. It does take time and there's a lot of factors involved, but it does indeed get better depending on what it is that you're coming in with. So if you'd like to discuss this with us, if you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can do a couple of things. You can either fill out a questionnaire and get some generalized feedback about what you answered and responded. It's not going to be super specific to you, but it will be based on some of the symptoms of things that you respond to. And then if you're just ready to take that step and you need to bypass this all and get treatment right away, then you want to schedule a consultation with us. You can go to the website, click on the consultation. It's going to take you through next steps. And with that, I'm going to say thanks for tuning in. Please do pass this information on if you feel like it could be beneficial to someone else. Hit the like button if you haven't done so already. And if you've not also done so, please subscribe to our channel so you don't miss any of our videos. Thank you.